Welcome, and thank you for joining EBSCO Health's presentation titled Emergency Room Overcrowding, Importance of Expedient Triage Skills. My name is Diane Hansen. I'm the Chief Nursing Officer and Editor-in-Chief of the Nursing and Allied Health Solutions at EBSCO Health. Even though I have not practiced as an emergency department nurse, I have worked with many ED nurses in developing evidence-based tools to support them in their professional practice. Also, like many of you, I've experienced the emergency department as a patient or a family member of a patient utilizing the service. I'm excited to spend time reviewing emergency department global concerns today, reviewing key strategies being utilized internationally to deal with overcrowding, and describe how nursing triage competence contributes to improved outcomes. Emergency department volume has continued to grow year over year at a steady pace. It is a global issue affecting hospitals in all countries providing emergency care. For the United States, the CDC provides some stats. 136.9 million ED visits per year, 39 million of those are injury-related. And the majority, about 50 to 75% of patients, get admitted to the hospital through the emergency department, and 35.4% of patients are seen in fewer than 15 minutes. Percentage of visits resulting in hospital admission is about 9%, and the percentage of visits that result in a transfer to a different hospital is 2.2%. So a lot of transfers not going out. So this is causing increased wait times, delay in services, and significant issues with patient family satisfaction with care. In addition, ED overcrowding and high occupancy of greater than 90% is associated with adverse patient outcomes, higher mortality, increased inpatient length of stay, and increased hospital readmission. Overcrowding in emergency departments is a multifactorial problem worldwide, occurring as a result of system constraints such as prolonged length of stay in the emergency department, inadequate healthcare staffing, delayed response to ED consultations, also frequent visit patients causing unnecessary, sometimes inappropriate repeated ED visits, and patients with also unmanaged chronic disease that keep using the emergency department. There's also a seasonality, such as influenza season or the start of school or high accident months that will increase overcrowding. Inpatient boarding and hospital-specific factors like size and location and lack of inpatient beds. Also, community services that are not available, such as behavioral health, can cause overcrowding. So those hospital bed shortages and high census and issues with patient throughput process are usually the highest reasons or causes for ED overcrowding. Too many non-urgent visits for patients, as I mentioned earlier, which are more primary care, also increase the overcrowding if there's not proper primary care access in the community. There have been many strategies deployed to decrease overcrowding in the emergency departments. These strategies can be organized into three categories. The first one's considered triage-related interventions, and they focus on improving the intake, assessment, and prioritization process for patients presenting in the emergency department. The second one is demand management strategies. These include resource allocation, staffing, the staff skill mix, care models, consultation management, proper use of equipment, specialty coverage, and EMS diversion policies. And the third is system throughput strategies, and these focus on bed utilization, setting up observation units, organizing by pods and patient acuity, improving inpatient length of stay, bed utilization, and then really evaluating discharge processes. Nurses play an important role in solving the issue of ED overcrowding and often participate in all of the work and organizational strategies I outlined. From a clinical practice perspective, many EDs are deploying nurses to work with physicians on triage-related interventions, so I will focus a little bit more on these specific interventions. Common triage interventions implemented by emergency departments include fast tracking, and these are ED fast tracking programs that create a separate process for patients with less serious conditions who can be treated more quickly and then released. Established criteria help the ED team determine patients who are appropriate to send through the ED fast tracking program without interfering with the treatment of seriously ill patients. Also, triage teams. This includes a combined physician and nurse triage team for rapid assessment process with the goal of significantly reducing the time to medical assessment, radiology, and to discharge during the intervention period. The goal is to move urgent patients more quickly into treatment rooms. Also, there's an intervention called streaming units. This is an innovative care delivery model designed to improve access to care by allocating similar patients with regard to their disease severity or the nature of the complaint to a particular work stream. For example, enabling moderately acute ambulatory patients who often wait the longest to be cared for in a separate area embedded within the main emergency department. These patients receive care to the same standards, but usually sit in a chair for most of their stay, only lying in a bed for examination, treatments, and tests. Another triage intervention is point-of-care testing, and this refers to any diagnostic test administered outside the central laboratory at or near the location of the patient. Using point-of-care testing, caregivers can perform, analyze, obtain, and act on test results at the bedside in a matter of minutes, so significantly faster. And then the last one I want to talk about is nurse-requested X-ray. This gives the triage nurse the ability to request X-rays as part of the assessment process, and it's based on approved protocols, and it speeds the diagnostics and appropriate treatment for certain patients. Emergency department nurses play an important role in the patient triage process to determine the extent of illness or injury and prioritizing interventions to optimize care. Learning patient triage and practicing will strengthen your skill competency. Some considerations. Time is of the essence. Initial triage should only take 5 minutes to identify immediate needs. The airway, circulation, breathing, disability, and exposure assessment, in addition to the Glasgow Coma Scale, can be used in that first screening. And using a triage prioritization skill can help determine the level from 1 to 5, 1 being most urgent and 5 being non-urgent for patients coming in through the ED. A secondary assessment should be performed after completing the primary assessment, including additional objective and subjective information. Having translators available for patients who do not speak the dominant language is also very important. And remember to continuously assess patients waiting in the ED for deteriorating conditions. Proper triage and controlling ED overcrowding can lead to improvements in outcomes related to quality, patient care experiences, and healthcare organization throughput and systems. So for quality, some of the things that you would notice as far as an outcome would be reduced time to treatment, early risk stratification, and improved appropriateness of diagnostic tests and procedures. With the patient care experience, what you hope to see is increased patient satisfaction, minimized wait times, and improved communication with the patient and their family throughout the process. And then outcomes that have impact on throughput and system would be to decrease patients who did not wait to be seen, who left the organization and were not treated, to decrease the total ED length of stay, and then earlier identification of patients who need to be managed outside of the ED in another level of care. So nurse triage in the ED is an important contribution to the quality of care, improves efficient, effective care, increases time to treatment and patient satisfaction, decreasing wait times and alleviating overcrowding. It's a great contribution.